Have social media companies deliberately designed their apps to get children and teens addicted to them? Hello, and welcome to the Dr. Suzette Glasner podcast. Don't forget to hit like if you learned something valuable from my video. And if you haven't done so already, please do subscribe to my YouTube channel. It's very easy to do and doesn't cost you a thing. And it really helps me to continue to be able to bring you content on mental health and addiction, trends, treatment, and science. Have social media companies deliberately designed their apps to get children and teens addicted to them? That is the core question that the jury will need to evaluate as Meta stands trial in California court in a Los Angeles-based case. This is the first of over 1,000 cases that have been filed against various social media companies, including YouTube, Instagram, Facebook, Snapchat, as well as TikTok, mostly by individual plaintiffs, but also to a lesser extent by school districts and state attorneys general. Essentially, what they're accusing social media companies of is engineering features that make their apps really nearly impossible to put down. And they're claiming that this is fueling a mental health crisis that leads, in some cases, to depression, eating disorders, and suicidality, as well as self-harm. So at the core of the case is a young adult identified only by the initials KGM, and it's KGM's case that could determine how thousands of other similar lawsuits against social media companies may play out ultimately. What KGM claims is that she started using social media at a relatively young age, I think somewhere between the age of 8 and 10, and she became addicted to it, and that caused a multitude of problems for her, including exacerbated depression and suicidal thoughts. What the lawsuit claims is that this was done deliberately through design choices that were made by the companies that really sought to make these platforms addictive to children in order to ultimately boost their revenue and keep kids on the platform for longer and longer periods of time, which could lead to compulsive use of social media. And the lawsuit also likens the techniques that were used by these social media companies in designing their apps to slot machines, alleging that they're really designed to produce addictive behaviors. So both TikTok and Snapchat's parent company both settled the case for undisclosed amounts in the week before the trial was set to begin, leaving Meta, which is Instagram, and Google, which is YouTube, as defendants. So from a legal standpoint, there are two questions. The first is, did those design features produce addictive behaviors? The second question is, did the design features of the platform cause harm? So in today's episode, I'm going to break down what we understand about the potential for social media to lead to addictive behaviors, especially in young people, and how that might be linked with their design and or their algorithms. The first question is, why is it so important to focus on the design features? And this is really related to some of the legal basis for KGM's case and all the subsequent cases that will follow. What this really comes down to is what's known as Section 230. Section 230 is a federal statute that says that social media platforms are immune from civil liability from what's referred to as third-party content. So what that means is that user-generated content or content that's posted by other people, when it comes to that type of content, tech companies are protected from liability for material that's posted on their platforms. So if it's the content that other people posted that KGM watched, and that's what caused her harm specifically, she saw videos of people who were doing certain things, maybe they were abnormally thin and that affected her body image, or whatever it is that she is going to put forth in the case. If it was the content that caused her the harm, then Section 230 federal statute would kick in and would provide immunity from civil liability to Google and Meta in this particular case. On the other hand, if it's the features, those design features that are causing the harm, that are producing addictive behaviors that then lead to harm, and that's what she's arguing it is, then there's a possibility that indeed Google and Meta could be held liable for causing her this harm. The implications of the jury's decision in this case are going to be significant for how children use social media and could lead to some regulatory requirements around the use of algorithms and other features that may be deemed to be sort of the mechanisms behind producing addictive behavior. I'm going to start with question number one, which is, did the design features produce addictive behaviors? So if you take Snapchat just as an example, their core features are sticky by design. Snap streaks, they push teens to message their friends every day. And if they don't do that, they will risk losing their streak. They can become very invested in those streaks. They use push notifications to nudge people to stay on the app for longer. And what these features do is they train young users to constantly check. Many kids feel like they just can't put it down because they need to check, even when they want to put it down. But as far as the features that may tap into addiction potential in young people and teenagers, there's really two ways that social media can do this from a sort of psychological theory and psychological research perspective. Two core ways. The first is by capitalizing on teenagers' hypersensitivity to social feedback. The second is by playing into underdeveloped impulse control capabilities that young people have. Let's start with the first one. How can a feature capitalize on teens' hypersensitivity to social feedback? And what do I mean by that? Young people starting from early puberty, let's say between ages 10 and 13, are not only very sensitive to what other people say and express thinking about them, but they're very interested in doing things that help them get praise or attention from their peers. Any of you who are teen parents know exactly what I'm talking about, really just looking for that social approval. Of course, as adults, we do this also, but teenagers' self-image is driven by this social feedback than it is for adults, just in general. So let's talk about likes. Getting likes on a post or a comment and seeing follower counts increase activates regions of the brain that are actually tied to reward. And we are all wired biologically to repeat things that stimulate our reward system. When our reward system is stimulated, there's chemical release that goes on, dopamine, our pleasure chemical. And for the most part, the things that elicit those pleasure reward responses are adaptive or healthy, right? They're eating, drinking, socializing, connecting with others, sexual activity. So we're wired to repeat those things for our survival. If something like getting likes or other kind of means of social reinforcement or comments on a post is having a similar kind of effect, then it is going to trigger repetitive behavior, more so in young people who are sensitive to positive social feedback than adults. Then there are other features like autoplay, infinite scroll, and algorithms that serve content recommendations to young people that maintain their engagement. And what that does is it sort of capitalizes on youth sensitivity towards peer influence. So the algorithm is going to be pushing content to them that reflects behavior of other peers and gives them some sort of social cues about how to do socially desirable things. And by personalizing the content in that manner, they're going to make it really hard for the young person to resist engaging with that content, given the stage of development that they're in. The second way that features of a social media design could uniquely produce addictive behaviors in young people is to the extent that their features exploit underdeveloped impulse control capabilities. Kids and teenagers are still developing individuals whose cortical systems are not what we would call mature until they reach their early 20s. So youth's developing cortical system, especially the network that's involved in inhibitory control, so suppressing or holding back responses based on rational thinking, it makes them less capable of resisting impulses or stopping themselves from a behavior that may lead to some temporary benefit or may feel good despite negative longer-term consequences. And that's why we're always trying to raise teenagers to carefully weigh the consequences of their action. And that's where a struggle for a lot of kids because their brain is not developed to that degree yet. So it's something they have to very intentionally do. This not only leads to impulsive decisions, but it can also interfere with focus on tasks that require concentration. Infinite scroll is particularly risky for young people because their ability to monitor and stop engagement on social media is just more limited than you would see among adults. So this can make it really hard for them to disengage from social media and might contribute to high rates of young people reporting symptoms of dependency on social media. There's also a lack of time limits. So the lack of time limits on social media use is also very challenging for young people because without limits during the school day or at times when they should be doing homework, it could be very tempting to scroll and engage with it unless there are very strictly enforced rules at school that might prevent them from doing so. And then the push notifications do something that is uniquely disruptive for people who are young and still have developing brains, which is that it capitalizes on their sensitivity to distraction. Young people are easily distracted, and part of the reason for that is that task shifting from one area of focus to another is what we consider to be sort of a higher order cognitive ability. It's something that develops as the brain is fully developing, and it doesn't fully develop until early adulthood. The second question is, do the design features cause harm? What does clinical science tell us about social media's addiction potential? We don't yet have an official diagnosis of social media addiction in our diagnostic system in psychology and psychiatry, but it is acknowledged as a growing source of global concern. The way it's documented currently is problematic use of social media. And it's abbreviated as PUSM, problematic use of social media. It's not formally labeled as an addiction yet, because there is research ongoing on how similar it is to other types of behavioral addictions or non-substance addictions, as well as addictions to substances. But the way that's defined, problematic use of social media is as loss of control over social media use, obsessive thinking about it, and spending so much time on social media that it has negative consequences in major areas of life functioning. It's where, and we see this with alcohol and drug addiction as well, somebody's using social media to an extent that other healthy behaviors are starting to take a backseat in the interest of staying on social media. So we're talking about educational pursuits. Maybe they're falling behind in their classes because they're spending so much time on it. Time that they're doing recreational things with their friends, they would rather be on social media, or they feel compelled to be on social media. Maybe they are backing away from sports or other leisure activities or physical interactions. Maybe it's interfering with their sleep because they're staying up so late on social media. There's also the distracting effect of social media on attention, memory, and learning. So it could be interfering with learning or school performance. And then finally, the use of social media to escape from negative emotional states. I talked about this on a prior podcast as far as the link between social media use in teens and suicidal thoughts and suicidal behaviors being less related to screen time itself, but more to the way that they're using social media. If they're using it as an escape, or if they're using it in a way that appears addictive, that is predictive of an increased risk of suicidal thoughts and behaviors, not so much the screen time itself. So when I talk about escaping negative emotional states, there's a range of emotional states that people could be avoiding, kids and teens, by using social media. And those could be anxiety. It could be withdrawal symptoms, that they're trying to avoid feeling uncomfortable when they're experiencing the absence of social media, which is a sign of addictive behavior. It could be kind of a FOMO thing, like a fear of missing out, that they're trying to escape from by using social media. If they're feeling left out of something that they wanted to do or wanted to be included in. Depression, loneliness, boredom, envy, all the range of emotions that young people and adults alike experience. Rather than learning how to cope with those feelings in healthy and adaptive ways, they're turning to social media. And it's that turning to social media as a coping mechanism that seems to be related to really poor mental health signs. Researchers are starting to take a look at this phenomenon in studies of what we call digital detoxes or digital detoxification, to see what's the impact when people try to disconnect from their social media on anxiety. To what extent do people experience cravings and other symptoms when when their social media access is taken away? So how common is this? Well, because there is not a great consensus on what problematic use of social media looks like exactly, different studies find different prevalence rates of problematic use of social media. So they range from single digits to 50%. But one meta-analysis, which is a review of lots of studies, they look at 31 separate studies of problematic use of social media. And based on what they saw across all those studies, they estimated a global prevalence of a little over 17%. That is very common, suggesting that we really need some solutions to this. Now, the extent to which this reflects a psychiatric disorder does remain debated, because some researchers are really viewing this as a way of expressing some pre-existing psychological problems. And I think that is going to be one of the challenges in the lawsuits against these social media companies, will be kind of establishing that what happened to KGM and to all the other individuals from a mental health perspective was the direct effect and only the direct effect of their use of social media, and not a secondary problem to other mental health problems that they already were vulnerable to developing, or that they already had before they started using social media in this compulsive way. So we also haven't in research yet identified who are the people, if there is an addiction syndrome to social media, which signs are pointing to there is, then who are the individuals who are most vulnerable to developing that? And it's probably the case that individuals with other addictive tendencies, with genetic predispositions, and also other mental health difficulties might be especially vulnerable to this, whereas people without those pre-existing conditions might not develop this compulsive pattern. But others, do consider problematic use of social media a specific psychiatric disorder, and we are finding that there are more similarities than differences between many other behavioral type addictions to internet, web surfing, etc., that have been more well documented. We actually don't have well-studied treatments for problematic use of social media yet, because we're still working on defining what it is. But from what we do know, the techniques with the most promise are the same as those that we use for people with substance addictions. So cognitive behavioral therapy, finding sort of alternative sources of reward, a therapy approach called contingency management, where the desired behavior of sort of like pulling back from social media or compulsive use of social media is rewarded with incentives. But the research is still in relatively early stages. So to wrap up, does KGM have a case? I'd say there's some data supporting the impact of features of social media apps on addictive behavior development. I do think that distinguishing the impact of those design features from the impact of specific content is likely to be tricky. That said, there really is cause for concern about addictive screen behavior in young people. So limiting access and monitoring for signs is going to be very important going forward for parents and for educators as we work to sort of pick apart this puzzle, figure out what's causing the problem, and how to properly diagnose it, and start to develop and study treatments for it.